Hello, welcome back. Come in, sit down. Today we have an episode that I think is genuinely one of the most important ones we've made, because today we are talking about your health. And your ability to talk about your health in English, in America, really, truly matters.
It really does. And I want to say up front, this topic can feel scary. Not just the language part, the whole system. American healthcare is complicated. It works differently from almost every other country in the world. And walking into a doctor's office when you don't fully understand how things work, when you're already not feeling well, that is a lot to handle.
It is a lot. And we are here to make it smaller. Not to fix the whole healthcare system. We can't do that today. But to give you the language, the vocabulary, the phrases, and the understanding to walk in, be heard, get help, and walk out knowing what happened and what to do next.
That's the goal, to be heard. Because when you can describe your symptoms clearly, when you can ask the right questions, when you understand what the doctor is telling you, you become your own advocate. Your health is too important to be lost in translation.
Lost in translation. What a phrase for this topic. It means something is misunderstood or lost when moving from one language to another. In medicine, something lost in translation can have real consequences. So today, we are keeping everything found, clear, understood.
Okay, before we begin, how are you today? And today especially, I want you to think about your physical health when you answer. I feel tired today because I haven't been sleeping well. Or, I feel healthy today, but I realize I don't know how to describe pain in English. Both are great answers.
And today's comment challenge. I'm your name from your country, and today I feel emotion because reason.
We read every one, always. Let's go.
Today's episode is How to See a Doctor in the USA, Medical English for Immigrants. And we are going to cover everything from start to finish. How the American healthcare system works at a basic level, how to find a doctor, how to make an appointment, what to say when you arrive, how to describe symptoms, how to understand what the doctor says, how to talk about medications, and what to do after your visit. We are also going to do some real role-play conversations, like we did in the bank account episode, because the best way to feel prepared is to hear the words used in context, to hear how a real appointment sounds. And we are going to give you phrases, specific, useful, real phrases that you can keep on your phone, write in a notebook, or just listen to until they feel natural. Because when you're sick and nervous and in an unfamiliar place, having words ready matters enormously.
This is B1 level, clear and natural. If you're a beginner, stay with us. We explain everything gently. If you're more advanced, this vocabulary is genuinely useful, and some of it might be new even to you.
Okay, let's start with the system itself, because understanding how American healthcare is organized changes how you navigate it.
The most important thing to understand about American healthcare is this: it is mostly private. Unlike many countries where healthcare is funded by the government and free or very low cost at the point of use, in America, most healthcare is paid for through insurance. Private insurance, employer insurance, or government programs for specific groups. Insurance, a system where you pay a regular amount of money, a premium, and in return, the insurance company helps pay your medical costs when you need care. Without insurance, medical care in America can be extremely expensive. A simple emergency room visit can cost thousands of dollars. A surgery can cost tens of thousands. So the first question when you need medical care in America is, do I have insurance? And if yes, what does my insurance cover? And what will I have to pay myself? Most people in America get health insurance through their employer, meaning their workplace pays part of the premium and the employee pays part through their paycheck, as we discussed in our paycheck episode. Others buy their own insurance through the government marketplace, and some people qualify for government programs. Medicaid, a government health insurance program for people with low incomes. If your income is below a certain level, you may qualify for Medicaid. It covers doctor visits, hospital care, prescriptions, and more, often with very low or no cost to you. Eligibility rules vary by state. It is worth checking if you might qualify.
Medicare, a different government program. This one is for people aged 65 and older, or for certain people with disabilities. If you are a working adult under 65, this is not yours yet, but it's good to know the word. And CHIP, the Children's Health Insurance Program, covers healthcare for children and families that earn too much for Medicaid but can't afford private insurance. If you have children and are worried about their healthcare coverage, look into CHIP. It exists specifically to make sure children don't go without care. And what if you have no insurance at all? There are still options. Community health centers, also called Federally Qualified Health Centers or FQHCs, are clinics that serve everyone regardless of insurance status or ability to pay. They charge on a sliding scale, meaning the less you earn, the less you pay. Some visits cost as little as $20. You can find one near you by searching Community Health Center Near Me or visiting the website findahealthcenter.hrsa.gov. Sliding scale, a fee that adjusts based on your income. The clinic charges on a sliding scale. I paid $30 for my visit. This is a lifeline for many uninsured immigrants. Please remember this option.
Okay, so you need to see a doctor. Where do you go? This depends on what's happening with your health. Let's walk through the options.
Primary care physician, or PCP. This is your main doctor, the one you see for regular health needs, a cold, a checkup, managing a chronic condition, getting referrals to specialists. In America, it's very important to have a primary care physician. They know your medical history. They coordinate your care.
Referral. When your primary care doctor sends you to see a specialist, a doctor with expertise in a specific area. My doctor gave me a referral to a cardiologist. In many insurance plans, you cannot see a specialist without a referral from your PCP first. Check your insurance plan to know if this applies to you.
Specialist, a doctor who focuses on one area of medicine. A cardiologist studies the heart. A dermatologist focuses on skin. An orthopedist treats bones and joints. A neurologist treats the brain and nervous system. A gynecologist focuses on women's reproductive health. An ophthalmologist is an eye doctor. If you have a specific health concern, a specialist may be who you eventually see, but usually you start with your PCP.
Urgent care. A clinic for medical issues that need attention soon, but are not life-threatening. If you have a bad infection, a minor injury, a fever that worries you, a sprained ankle, urgent care is appropriate. You don't need an appointment. You walk in. It costs less than the emergency room, and it's available evenings and weekends when your regular doctor might be closed.
Emergency room, or ER. This is for life-threatening or serious emergencies. Chest pain, difficulty breathing, severe bleeding, a serious accident, loss of consciousness, head injuries. If in doubt, go to the ER. In America, emergency rooms are legally required to treat you regardless of your insurance status or ability to pay. You will receive a bill afterward, and there are ways to negotiate or apply for financial assistance, but you will not be turned away in an emergency.
And that is a crucial fact. Emergency rooms cannot legally turn you away because of inability to pay. If you are in a genuine emergency, go. Worry about the bill later. Your life is worth more than the bill.
Telehealth, a relatively new option that became very common after 2020. Telehealth means seeing a doctor by video call or phone call instead of in person. For minor issues, prescription refills, or follow-up appointments, telehealth can be very convenient. Many insurance plans cover it. And for immigrants who are nervous about in-person English conversations, a video call from home where you can have notes nearby can feel more manageable.
Okay, you found a doctor. You need to make an appointment. Let's talk about the phone call. Because for many people, phone calls in a second language are still the most stressful part.
They are. And we want to give you a full script right now, word for word, so you can practice it. Read it, keep it on your phone.
Let's do the role play. I'll be the receptionist. You are the patient calling to make an appointment.
Ready.
Thank you for calling Riverside Family Medicine. This is Sandra. How can I help you?
Hello, my name is Marco Reyes. I would like to make an appointment to see the doctor, please.
Of course. Are you an existing patient with us, or is this your first visit?
This is my first visit. I'm a new patient.
Great. Can I ask what brings you in? What seems to be the issue?
I have had a sore throat and a fever for 3 days. I would like to have it checked.
Understood. And do you have health insurance?
Yes, I have Blue Shield insurance.
Perfect. We accept that. Can I get your date of birth and a phone number where we can reach you?
Of course. My date of birth is March 14th, 1990. My phone number is 555-204-8731.
Stop there. Listeners, notice a few things. First, what seems to be the issue is a very common receptionist question. It means, what is wrong? What are you coming in for? You can answer simply, I have a headache. I've been coughing for a week. I need a checkup. I have a rash I want looked at. Simple sentences are completely fine.
Also notice, are you an existing patient? Existing patient means you have been to this doctor before and they have your records. New patient means it's your first time. Knowing this distinction saves confusion.
A few more useful phrases for making an appointment. I need to schedule a routine checkup. A routine checkup is a regular health visit when nothing is necessarily wrong, just maintaining your health. Do you have any availability this week? Availability means open appointment slots. Is there an interpreter service available? If you need help in your native language, many clinics can arrange a phone or video interpreter. You have the right to request this.
Interpreter, a person who translates spoken language in real time. I requested an interpreter for my appointment. This is different from a translator who works with written text. In medical settings, you can ask for a medical interpreter. It is your legal right under federal law in many cases. Do not be afraid to ask.
You made the appointment. You arrived. Now what happens? Let's walk through a typical visit.
You walk in and go to the front desk, the reception area. You check in. This means you tell them you're there for your appointment. They will ask for your name, your insurance card if you have one, and possibly ask you to fill out forms if you're a new patient.
The new patient forms are often long. They ask about your medical history, past illnesses, surgeries, allergies, medications you currently take. They ask about your family medical history, conditions that run in your family, and they ask for basic information, your address, emergency contact, insurance details.
Emergency contact, a person the medical staff can call if something happens to you and you cannot speak for yourself. This should be someone you trust. My emergency contact is my sister, Fatima. Her number is. Always have this person's phone number ready.
After you check in and fill out forms, you wait. American doctors' offices often have waiting rooms with chairs, magazines, a television. You may wait 15 minutes or an hour. Waiting is unfortunately a normal part of the experience.
Then a nurse or medical assistant calls your name. They take you to an exam room, a small private room. They measure your vitals. Vitals are the basic measurements of your health. Your blood pressure, your heart rate, also called pulse, your temperature, your weight and height. These numbers give the doctor a quick picture of your current health.
Blood pressure, the force of blood pushing against your artery walls. It's measured as two numbers. Your blood pressure is 120/80. Normal is around 120/80. High blood pressure, called hypertension, can be a sign of health risk. The nurse will tell you if it seems high or low.
The nurse may also ask you, what brings you in today? Or, can you tell me your symptoms? Symptoms, the signs your body shows when something is wrong. A cough, a headache, a rash, nausea, fatigue. These are all symptoms. Be ready to describe yours clearly.
Then the doctor comes in. They will ask you more questions. They will examine you, look in your ears, throat, listen to your heart and lungs with a stethoscope, press on your abdomen if needed. They are building a picture of what's happening in your body.
This is perhaps the most practical chapter of the whole episode, how to describe what you feel in your body, in English, clearly enough for the doctor to understand.
Because this is where language really matters. If you can't describe your symptoms well, the doctor can't help you well. And if the doctor doesn't understand what's wrong, they might miss something important.
So let's build your symptom vocabulary, starting with pain, because pain is the most common reason people go to the doctor.
Doctors often use a pain scale. They ask, on a scale of 1 to 10, how would you rate your pain? 1 is barely noticeable. 10 is the worst pain you've ever felt. This scale exists in every language and every culture. Just give a number. I'd say about a 6. It's around a 3, uncomfortable but I can function. It's a 9, I can barely stand it.
And they also want to know what kind of pain it is. Here are the most important English words for types of pain. Sharp, a sudden, intense, stabbing sensation. I feel a sharp pain in my side when I breathe. Dull, a low, constant ache. Not intense, but always there. There's a dull ache in my lower back. Throbbing, a pulsing pain that beats in rhythm with your heartbeat. Common with headaches and toothaches. I have a throbbing headache behind my eyes. Burning, a sensation of heat or fire. There's a burning feeling in my chest after I eat. Cramping, a tightening, squeezing pain. Common with stomach problems or muscle pain. I've been having bad cramping in my stomach.
Shooting, pain that travels down or along a body part. I have shooting pain that goes down my leg.
Those 6 words, sharp, dull, throbbing, burning, cramping, shooting, are what doctors want to hear. Learning them is one of the most useful things you can do for your healthcare experience.
Other important symptom phrases. I've had this symptom for amount of time. I've had this cough for 2 weeks. It gets worse when I do something. It gets worse when I eat spicy food. It gets better when I do something. It gets better when I lie down. The pain comes and goes, meaning it's not constant. It appears and disappears. The pain is constant, meaning it never goes away. It started suddenly, or it came on gradually. Suddenly means all at once. Gradually means slowly over time.
And locations, being precise about where something hurts. In my chest, in my lower back, behind my left eye, in my lower right abdomen, on the right side of my neck, in my joints. The more specific you can be, the better.
And there is one phrase that is always important to say if it's true. This has never happened to me before. Or its opposite. This happens to me regularly. Or this is getting worse. These context clues help the doctor understand urgency.
Urgency, how quickly something needs attention. Given the urgency of his symptoms, the doctor ordered immediate tests. Telling your doctor this is getting worse or this started suddenly signals urgency.
After the examination, the doctor shares their assessment. They may give you a diagnosis, their conclusion about what is causing your symptoms. You have a bacterial infection. This looks like it could be an allergic reaction. Your blood pressure is elevated, and I want to monitor it.
Diagnosis, the identification of a medical condition. The doctor gave me a diagnosis of bronchitis. From the Greek, dia, meaning through, gnosis, meaning knowledge. Through knowledge. The doctor uses knowledge to identify what's wrong.
And then they explain what they recommend. They may prescribe medication. Prescribe, to officially write an order for medication. The doctor prescribed antibiotics for 10 days. A prescription is the written order. You take it to a pharmacy to get the medication.
Pharmacy, a store or part of a store where prescription medications are prepared and sold. In America, pharmacies are found inside many grocery stores and drugstores like CVS, Walgreens, and Rite Aid. You hand over your prescription, or the doctor may send it electronically, and the pharmacist prepares it for you.
When you pick up your medication, the pharmacist may explain the dosage, how much to take and how often. Take 1 tablet twice a day with food. Take 2 capsules every 6 hours, no more than 8 in 24 hours. Listen carefully to these instructions. They are important.
Dosage, the amount and frequency of medication. Follow the dosage instructions on the label. I'm not sure about the dosage. Can you explain it again? It is always okay to ask the pharmacist to explain dosage again. That is literally their job, and they are glad to help.
The doctor may also order tests. Blood tests, where they take a small amount of blood to check various things. An X-ray, imaging of bones and certain organs. An MRI, a more detailed imaging scan. A urine test, a throat swab. These tests give the doctor more information.
The doctor ordered some tests, a phrase you will hear. Ordered in this context means requested, not demanded. She ordered a blood test and asked me to come back in a week. Following up on ordered tests is important. The results might change your diagnosis or treatment.
And the doctor may give you a referral to a specialist, as we mentioned earlier. I'm going to refer you to a gastroenterologist, a doctor who specializes in digestive issues. I'd like you to see a dermatologist about that rash.
If the doctor says something you don't understand, ask. Always ask. These are useful phrases. I'm sorry, could you explain that in simpler terms? What does that word mean? Can you write that down for me? What happens if I don't treat this? Are there any side effects I should know about? When should I come back if things don't improve?
Side effects, unwanted or unexpected effects that a medication or treatment may cause. The antibiotic may cause some side effects like nausea or dizziness. Knowing possible side effects helps you know what to watch for and what is normal versus what is a new problem.
We have to talk about the money side, because in America, a doctor's visit involves not just medicine, but billing, and the billing system is its own language.
After your visit, you will likely receive an explanation of benefits, often called an EOB, from your insurance company. This is not a bill. It is a summary of what the doctor charged, what your insurance agreed to pay, and what you owe. It can look like a bill, but usually at the top or bottom it says, "This is not a bill."
Explanation of benefits, a document that explains how your insurance processed your medical claim. I received an EOB and it showed my insurance covered 80% of the visit. Read it carefully. Make sure the service listed is actually what you received.
Then later, sometimes weeks later, you may receive an actual bill from the doctor's office or hospital. This is the amount you owe after insurance paid its part. This is called your out-of-pocket cost, a term we learned in the paycheck episode.
And some important terms to know on bills. Copay, a fixed amount you pay at the time of your visit. My copay for a regular doctor visit is $30. You pay this when you arrive. Deductible, the amount you must pay out of pocket before your insurance starts covering costs. My deductible is $1,000. This means you pay the first $1,000 of medical costs yourself each year. After that, insurance kicks in more fully. Coinsurance. After you meet your deductible, you still pay a percentage of costs. I pay 20% coinsurance and insurance pays 80%. Common splits are 80% or 70%. Out-of-pocket maximum, the most you will ever have to pay in 1 year. After you reach this number, insurance covers 100% of covered costs for the rest of the year. My out-of-pocket maximum is $5,000.
Those 4 words, copay, deductible, coinsurance, out-of-pocket maximum, are the insurance vocabulary that matters most. They are the 4 walls of your financial healthcare picture.
And if you receive a bill you cannot afford, call the billing department immediately. Say, I received this bill and I'm having difficulty paying it. Is there a payment plan available? Is there financial assistance I can apply for? Many hospitals and clinics have financial assistance programs, sometimes called charity care, for people who cannot afford their bills. Charity care, financial assistance provided by hospitals to patients who cannot afford to pay. You usually need to apply and provide proof of income, but it exists and it can reduce your bill significantly or eliminate it entirely. Ask for it. You have nothing to lose by asking.
Okay, we're in the gentle part now. The word tour. Breathe out. Let's just walk through the keywords slowly. Let them settle.
Nice and easy. No rush. Word 1, primary care physician, PCP. Your main doctor for everyday health needs. The first person you see for most medical issues. Example, I found a primary care physician who speaks Spanish and accepts my insurance.
Word 3, urgent care. A clinic for non-life-threatening issues that need attention soon. No appointment needed. Example, I went to urgent care because my ankle was swollen and I couldn't wait.
Word 4, vitals. Basic health measurements. Blood pressure, heart rate, temperature, weight. Example, the nurse checked my vitals before the doctor came in.
Word 5, symptoms. The signs your body shows when something is wrong. Fever, pain, rash, fatigue. Example, I described my symptoms and the doctor immediately ordered a blood test.
Word 6, diagnosis. The doctor's conclusion about what medical condition you have. Example, the diagnosis was a sinus infection, nothing serious.
Word 7, prescribe, prescription. To officially order medication. The prescription is the written order you take to a pharmacy. Example, the doctor prescribed antibiotics and I picked them up at the pharmacy.
Word 8, dosage. How much medication to take and how often. Example, the dosage is 2 tablets in the morning and 1 at night.
Word 9, copay. A fixed amount you pay at the time of your doctor visit. Example, my copay is $25 every time I see my regular doctor. Word 10, deductible. The amount you pay yourself before your insurance starts covering a larger share. Example, I met my deductible in March, so now insurance covers most of my costs. Word 11, charity care. Financial assistance from a hospital for patients who cannot afford their medical bills. Example, I applied with charity care and my hospital bill was reduced by 70%. 11 words today, because your health deserves extra vocabulary. Pick one. One sentence. Say it out loud. Write it somewhere.
And if you are facing a medical situation right now, if there is something in your body you've been ignoring because you were afraid of the language barrier or the cost, I want to gently encourage you. Please go. Please seek care. There are options. There are people who will help you.
Your health comes first. Always.
That was our episode. How to see a doctor in the USA. Medical English for Immigrants. From understanding the system, to finding care, to making the call, to describing your pain, to understanding your prescription, to reading your bill. All of it.
And I want to leave you with something important. In medicine, in healthcare, you are not just a patient. You are a person with a voice.
You have the right to ask questions. You have the right to request an interpreter. You have the right to understand your diagnosis. You have the right to say, "I don't understand. Please explain that again." The language barrier does not take away your rights. It just makes them harder to exercise. And that's exactly why we made this episode. To give you the words. To give you back some of what the language barrier takes. Take care of yourself. That is not a small thing. That is everything. You cannot show up for your job, your family, your English class, your dreams, if you are not taking care of your body. You are part of this cozy club. No insurance card required for entry. Just show up, listen, try, and we will always be here. One small step at a time. Maybe today's step is writing down your symptoms in English, or finding the closest community health center, or looking up what VITA or Medicaid might mean for you. Any one of those steps is enough. Leave us your comment. I'm blank from blank, and today I feel blank because blank. Like this episode, subscribe, and share it with someone who has been putting off going to the doctor because the language felt too hard. This episode might be the push they needed. It might just be Sophie and Jamie. And you are always, always welcome here. Take care of yourself. We mean it.